Welcome back to our channel, Medical Info That Makes Sense, and we are here to explore so many courses for medics in the field and to give you more insights into some of those courses that might interest you. Now, tonight we are here to discuss matters physiotherapy, and we have been pleasured to be joined by Sajja Joel. You're most welcome to Medical Info That Makes Sense.
Thank you. I'm also humbled to join you, sir.
All right. Sajja Joel joins us from Mengo Physiotherapy Department and is here to benefit you, a learner out there. You could be a senior 4, a senior 6 a person, or a certificate holder, probably a diploma personnel who wants to join the cadre of physiotherapy. And that is why today we have been pleasure to be joined by Sajja. Tell us about you and how you come to the decision of physiotherapy.
Well, physiotherapy is an interesting thing, personally for me.
Yes.
How I came to join it is quite tricky, but probably what I can say that I'm solution-oriented as a person. One, I have a diploma in clinical medicine, and I also have a bachelor's in physiotherapy.
Okay.
From Ernest Cook University.
Bachelor's degree in physiotherapy.
Bachelor's degree in physiotherapy.
Yes.
How I came to join it as a clinician, I got faced with so many people, the elderly, and their chronic conditions they do have. That includes musculoskeletal problems.
Yes.
The bone issues, the brain issues, neurology issues, and you find as a clinician, I had stopped giving help to them.
Yes.
That's when now rehabilitation through physiotherapy came in as a solution. So I'm like, now to bridge this gap, I need to go further and get to a better understanding of how to help such people. And that's how I came to join physiotherapy, basically.
Okay. Now we understand that we have started from your personal story of how you joined physiotherapy. But for people watching us for the very first time, or for any person hearing the word physiotherapy, help us understand who is a physiotherapist and what is physiotherapy?
Have you heard about programming?
You mean computer programming?
Computer programming.
Yes.
And do you know how interesting it is that now kids out there, when they tell them AI has come, programming, coding, and so on has come, and they're using now artificial intelligence, they're using machines, robots, and so on.
Yes.
Now with the physiotherapist, now you're doing programming, you're doing coding for a human body.
Wow.
That's how interesting it is.
You're doing programming for a human body. Wow.
For someone to understand it, that's how I would give it to them.
Okay.
And a person is not working well. A person is having pain. Now I come to program the nervous system to tell it, please don't make someone feel hurt. So it is a response of the nervous system and how they're doing their ways. Someone is not working well, so we have to program them to work the particular way we want them.
Yes.
Someone is having an issue, let me say a stroke, is having paralysis. Now we need to do programming so this person can regain and restore their function that used to be there before. So now as a physiotherapist, you're actually going to work around biomechanics. You're going to work about pathophysiology to ensure you're helping this person restore their function, mobility, and maximize, let me say, their potential.
Okay.
In doing certain things.
Yeah. All right. Now, colleagues, I want to remind you that this channel, Medical Info That Makes Sense, is proudly sponsored by Midland High School, Kawempe. If you're a student seeking for secondary school education, please reach out to the 21st century head teacher, Mr. Katelega Mark, and he will do you good. Joel, I still want to bring you back on board as we discuss matters physiotherapy. A number of people in the community mistake physiotherapy to be so many things. Tell us about the myths that surround the profession of physiotherapy.
Well, interestingly, many people want to involve physiotherapy in most of their conversations, but they're lacking the information.
They don't have the full understanding.
And really, we are not also, as physiotherapists, who have taken the passion to actually, I have passion for physiotherapy.
Yes.
And I wouldn't, they normally say, if you don't want to be touched by the tails of the dog. Don't engage in their dances.
Don't engage in their dances.
Exactly.
Exactly.
So first and foremost, for a physiotherapist, you must have the knowledge of physiotherapy. You must go to school and do anatomy. You know about the nerves, the bones, the joints, and name it.
Yes.
Secondly, you have to have passion for it in communication. I'll tell you an example. For example, a patient has got his fears, anxiety, name them. And if you're a therapist and you cannot alleviate their fears, you may fail to have an outcome. And you have to work through ethics as well. You know, you must understand that the confidentiality, the patient's autonomy is well protected.
Yes.
And which you may not find in people who are just getting certificates. But well, maybe to give you a better understanding, that people now who think, let me ask you, what are some of the myths that you've heard about? Because particularly me, I've not heard of one.
For me, I think I've found myself, personally, I've found myself thinking that physiotherapy is only about bones. It's only about accidents. I'm looking at a patient who has succumbed to an accident and how they are gaining back full function. I tend to think that into physiotherapy. And it seems like it's the only thing that comes to my mind when I think of physiotherapy.
So you cannot think about anything else?
I am virtually not able to think beyond that. Helping someone walk well, you know, again, back again, if they have suffered a bad accident.
Then that is not a myth. That is purely just limited of knowledge. So it's not a myth. You simply just need to know where physiotherapy applies. And physiotherapy has got categories or division or specialties.
Tell us about the different categories of physiotherapy that are in practice today.
Well, there are about 10, even maybe more to come.
About 10?
Yes.
Different
categories of physiotherapy, divisions.
Wow.
Of physiotherapy. Maybe to guide you a little, you first have a bachelor's, undergraduate. So you become a physiotherapist, number one. Then there are 10 specialties you would wish to join.
After your bachelor's?
After your bachelor's. Okay. You're going to just be a physiotherapist. And I always tell people the future of physiotherapy is always in specialization.
Okay.
Number one is musculoskeletal orthopedics. It's the most popular one. Every PT is going to upgrade in it. Whether they're having a postgraduate diploma or they're having a master's in it.
Okay.
Most people are running for it is because the most selling is the most...
It's a hot cake.
It's a hot cake.
Wow.
It's where we find most of our problems here. Every every orthopedic surgeon will definitely require. For every surgery that is done, you need physio to be part of the treatment a person is getting. Every surgery is done.
And there are so many accidents that are happening in Uganda because it is one of the leading causes of injury.
Yes, and basically, because we have so many accidents and injuries in the country, just know your job security as a physiotherapist will be guaranteed. Because at any one time, someone will be getting an accident.
Until when safety measures and
exactly, so your job security is safe, is guaranteed in the same. Now we have geriatrics. These are the elderly.
Yes.
At one point in the history of the world, there was baby booming.
Yes.
And so many kids were brought into this planet.
Therefore,
those people also are aging.
Yes.
Just know, so your job security as a geriatric physiotherapist is also guaranteed.
Surely.
Once you take that path, it's guaranteed. And number 3, we have sports physiotherapy.
Sports physiotherapy.
There are so many injuries, whether chronic or acute, that are attained through sports.
Yes.
And there are so many sports now is becoming one thing in some countries. It's actually this one thing that actually even runs some economies. Maybe in UK. Just know now, there will be no time on any weekend, any public holiday where people do not want to go and engage in sports.
Exactly.
And injuries, and whether chronic or acute, will always be there.
Yes.
So you come in to help with the pain, with ligament, nerve, malalignments, and so on that you get while doing sports. Even for fitness, number one, just to go and play it, you need fitness, and you need a fitness person that will be a physiotherapist.
A physiotherapist can equally fit into the fitness.
Now, fitness guys, they just get a course from physiotherapy and then they teach to them so that they can do it because because it requires a lot of time to go and study physiotherapy. Study the whole book of anatomy. You guys, because of time, so just why not in the need of demand?
So the fitness people just pick a little bit from physiotherapy.
And it is done out of demand, that there is a lot of demand for it.
Exactly. Sports is one of the growing activities in the country.
Exactly. The same way why we have certificate nurses because of the demand of their service.
Okay.
So we don't want to just get one nurse after 5 years to get one.
Yes.
So why don't we get one after maybe 1 year, after a course of 6 months?
So that they fit that gap.
That shows you
that
the
is
demand.
How fitness guys are coming into. And there are, by the way, very many in the present
I'm telling
day.
you. And they're doing a wonderful job, of
Yes.
course. And so sports physiotherapy is another also hot cake. One of also the most paying, because of course there's money in sports.
Exactly.
It's one of the most paying. Now I've given you the three.
Yes.
They're the most paying and they're the most selling, the most popular.
Okay.
Sports physiotherapy, pediatrics, and orthopedics.
Wow. Wow.
Then we have pediatrics. Okay, I want to mention much. We have women health. Some call it now these days popularly known as pelvic floor specialists. We have oncology.
I think first give us a good understanding about the women physiotherapy. I think it's a good sector.
The women health, women have got a lot of issues due to the hormonal changes. This affects their growth and development of their ligaments of the pelvic floor, the muscles, the spine, you get. Also their movement is altered because of the several health issues they have. Even the cramps alone during their menses, they are also, the intervention is also can be physiotherapy.
Yes.
It is physiotherapy as well. Now there's a different specialty for that. That now you have someone who's basically focusing only your pelvic floor, your women health matters issues, including pregnancy. Before pregnancy, what you need to do as you prepare for exhaustive exercise you're going to do as you're delivering, then you want to restore shape, function of your muscles and so on, then you need someone to help you go through that process. And then if you have issues, you want to improve your stamina and maybe excitement during bedroom affairs, still you may need a physiotherapist to come and guide you through that process.
Wow.
Even if you're a man and there's loss of libido, poor ejaculation,
loss of function,
maybe you quickly ejaculate, or maybe you delay, you get, or maybe you can't take long, still a physiotherapist person comes in.
All that can require a physiotherapist.
I'm telling you, that's what they do. Pelvic floor specialists.
How come people don't know about the contribution of a physiotherapist in this kind of way?
Well, number one, I always tell people that the first contact of most of our patients in our country is always, it could be the nurse, it could be the doctor, the clinician, the first person. Now, I think what you need to do more is more of education to these first people of contact.
Educating the frontliners, workers,
social workers,
yes,
occupational therapists, nurses, the VHTs. So once they know that if one has got a problem, maybe with a prostate, with passing urine, with incontinence, name it, with pregnancy issues afterwards, before or after,
restoration of functions,
they should refer that person to a physiotherapist.
Wow.
Of course, even these engagements could really help. I think there will be more people coming in. And that's why actually I think we are looking forward for more entry of people engaging in this field of physiotherapy. That's when maybe awareness can really reach to most of the people out there.
Wow. Now, tonight we have been joined by Dr. Sajja here, and we are discussing physiotherapy today. Thank you so much for enlightening us about the different categories of physiotherapies in Uganda. We want to come to an understanding of how does someone join physiotherapy. A learner out there, a student out there, a certificate person out there, or a diploma person out there. How do they join the field, and how far can they grow within?
Number one, the field is very diverse. It's a large field.
Okay.
Everyone can have a portion among all the specialties. To begin from the lowest part is the certificate, as I mentioned, there is demand. So now certificate courses come in to bridge the gap of time you spend while in school. You have a 6-month course in women health. You don't become the expert, but you give the first provision care.
You put yourself at the front line.
At the front line.
Yes.
You get number one. So even if you're a senior for liver, you can have a certificate in, let me say, in fitness. And you're going to join a team. And after that, there are FIFA. There is, FIFA has got courses. Actually, I have one.
Yes.
I have a diploma in FIFA sports science.
Wow.
As well. So once you have any diploma before, but I think they don't need, the moment you can read and understand and pass their course, you get. It's online, it's free. And then it can take you whatever time you need. It's a self-study. It's
self-paced.
Self-paced.
Yes.
The content is there. You can want to move to the next level before passing the next. So you must read everything. So you pass and you get, the certificate is accredited.
Okay.
You can move with it from here to the next, and you'll be part of the physiotherapist of a given team.
Yes.
Here in the country.
Because I understand that I follow basketball, the Federation of Basketball of Uganda, and I understand that every team, on every basketball team, you need a physiotherapist or a fitness person,
Exactly.
a technical person to help with the player's health.
Exactly. Fitness. And this also goes to every person that is working with any team and would want to have a certificate of their own.
Yes.
There is FIFA. It's a diploma in FIFA sports science.
Okay.
You're more on critical care of sports injuries, acute or chronic.
Okay.
Yes. Number two, once you have, because I'm speaking this way because I'm speaking from the context of our country.
Yes.
Now we have people who are nurses, certificate nurses. We have people who have diplomas in nursing, maybe clinical medicine. You can easily upgrade from your diploma in nursing or to clinical medicine, and then you come to a bachelor's in physiotherapy.
Are you suggesting that all allied health diplomas
exactly
can have someone access a bachelor's degree in physiotherapy?
Definitely.
Okay.
And this is available at Ernest Cook University, located in Mengo. For senior 6 leavers. Then, of course...
Is there, just to clarify, is there any special considerations for diploma entry in the sense of the minimum CGPA and all that?
Literally, for that matter, the moment you've qualified, you're already certified.
You've qualified as a professional with the diploma.
With the diploma.
Yes.
That is the
minimum.
Yes.
All right.
That's a bare minimum. It doesn't matter. Yeah. Because we believe, anyway, that will be for another day.
Okay.
But it doesn't matter.
All right.
It doesn't matter. Yeah. Now, for senior 6 leavers, you can join physiotherapy bachelors. That is now available in Mbarara University, Makerere University, and then Ernest Cook University.
Okay. And
also from senior 6, you can also go for a diploma in physiotherapy, which is available in UAHAMS,
Mulago. So when you talked about diploma entry, you mentioned Ernest Cook, and you did mention Mbarara and Makerere.
When I mentioned
diplomas,
people who are already diploma holders.
Yes. So does that mean that Mbarara and Makerere will not give diploma entrant?
For now.
For now.
Yes.
Interesting insight.
For now. But if you have a diploma in physiotherapy, then Mbarara will give you.
Oh.
It will be full-time. Still, it will take you the 4 years. It's a 4-year course. You get. It's a 4 years course for whatsoever, be it a senior 6 or a senior or a diploma entrant. Yeah.
It is a 4 years course.
Yes.
And the diploma is how long?
Diploma is 3 years.
3 years, okay.
Diploma is 3 years.
Yes. So I cut you short when you're talking about a senior 6 who can go for a diploma.
Yeah. Because now we know that to some extent you may wish to, your points may not qualify you to enter university. and then you use the diploma side as an alternative, an alternative route to achieve what your dream of becoming a physiotherapy. Yes, so there is also that route of diploma in physiotherapy, which you find in Mulago, your Hams.
Is it the only institution that has it?
To my knowledge, for now.
All right. Okay.
But Ernest Cook, from the recent developments, I think they're trying to also to start it.
Okay.
Yeah.
What next after your bachelor's degree with in physiotherapy?
Personal or for everyone?
For everyone. What next?
I mentioned earlier about the specializations.
Oh, that is where they come in.
That's where they come in.
Okay. Okay.
After your bachelor's, in US, in also UK, there's people they call PT, meaning physiotherapist, and then there's one they call DPT, meaning doctor of physiotherapy. So when you mentioned earlier that this is joined by doctors, I wanted to make that correction by telling you I'm not yet a doctor, because you need to first finish your 4 years course of physiotherapy, undergraduate, and then you add on 3 to become a doctor of physiotherapy.
So what is the title of a person with a bachelor's degree in physiotherapy?
He's a PT.
He's a PT. He's a physiotherapist. Oh, wow. Interesting.
Now, then to become a doctor of physiotherapy, then you add on 3 years of that doctorate.
Of that specialization.
And how they differ is one supervises the other, one is independent. This one has to work under supervision. This one makes the diagnosis, will make a diagnosis, will make a follow-up, will make a referral, can stop treatment, can start treatment. This one you can do all, but under supervision of the other. You get my point? And here you're more on diagnosis.
Okay.
To be a doctor or a therapist.
Okay.
You're more of diagnosis. You can diagnose and then tell a PT, you can now initiate this kind of program for this patient.
Wow. Now, having understood from the genesis of how someone becomes, the different parts within the physiotherapist, some of the things that we didn't know exactly as a society about physiotherapy, we want to now understand how is the demand, how does the market demand look like for anyone who would wish to join the physiotherapy department?
I would want to understand your question as you're asking for the benefit of those who want to know how much they earn. Because number one, the demand is insane. You get everyone would need physiotherapy. I can tell you, even when you have appendicitis, there's a physiotherapy for it on pain modulation. Even when you have terminal heel cancer, you get there's physiotherapy intervention. Even when you just get a mere bruise, even wound healing, just having wounds, there's physiotherapy intervention for that. So every person, whether you're young or old, physiotherapy is an intervention you all may need. So no doubt. Now the question is, are people aware about it? Do health workers know about it? Then it's in terms of making money, they're highly paying because they are specialized. Because the moment in this economy you are solving a problem of someone, you're automatically going to be of demand. You make your own paycheck. You get my point? For current salary scales of different people, diploma holders, they're earning around 1.5. In any case, for government diplomas, you'll be as a diploma person.
Yes.
You're earning your to something and your net is maybe 1.9. For a bachelor's physiotherapist on government payroll, you earn like any bachelor's individual doctor or so on, and you'll be earning for something or your net is 3 point something. No doubt.
Yes.
Now the issue comes in private practice. Is there demand? Is there jobs for private practice? I can tell you, diploma holders in NGOs are earning 3 million. Rehabilitation centers in Gulu, Ajumani, in refugee camps. 3 minimum is there basically, and then you add on their field allowances, transportation, fuel, accommodation. It's insane amount of money for earning. here in town in modern clinics, you would understand if you're owning a private clinic, of course the goal is self-employment, privatization. Sessions are now coming from 50K to 100K to 150 per patient.
Individual sessions.
Individual sessions.
One-on-one sessions.
One-on-one sessions. You have a number of 5 sessions or 3 sessions with a patient, and you're getting from them 50K bare minimum. 50K, that is 150. Now you just need to have 5 patients, 3 sessions.
And yet you have told us every person in some moment in their life, they are going to need a physiotherapist.
That is it. And as I told you before, in the geriatrics, problems that come with age, there are a lot of elderly people in this country. Your job security will be there. Neurology, stroke, hypertension, those are chronic illnesses. People are being affected. They are getting neuropathy, they are getting bone degenerations, so they're getting disc prolapse and malalignment, posture problems. They always come. You'll have a very good number of people of such. And then orthopedics, injuries, fractures, as we said, accidents every day here. At least there'll be 1 or 2 or 3 people who get an accident and they'll need your intervention. So people are there to treat on when you start your private clinic.
Wow.
You get my point. So for me, I believe the ball is in the hands of the therapist. You can make as much as money as you need. Your only limitation.
As long as you qualify for the...
Exactly.
Wow. Now, colleagues, we have been joined by Sajja this evening, and we are getting a deep understanding of physiotherapy in Uganda, and so far, so good. Sajja, for your final message to the people following this live, I mean for the people following this show, someone who wants to join the course, someone who has never heard about it, what would be your final words for them?
Well, physiotherapy is a passion-driven course. I would be more interested in someone who has passion for physiotherapy. And of course, the bare minimum, we are speaking to people who have senior 6 qualification, who have senior 4 qualifications. You definitely qualify with your 3 principal passes. You definitely qualify. If you want a bachelor's, and the limit is the sky.
Yeah.
You can become any specialty you want. You can become a doctor of physiotherapy, on-call specialist, ped specialist, orthopedic, sports, geriatrics, name it.
Wow.
Electrophysiology, name it. So I believe your passion to solving problems, if you have a passion to change one person, change that person, and you have a chance to be a programmer of human body, human life. That's how interesting this course can be. And if you're that very person, I believe this course is for you, because you'll have lives you'll be changing, problems you'll be solving for very many people, and you'll make a mark on the lives of many people.
You leave a difference.
Exactly.
On this planet.
Exactly.
Wow. Thank you so much, Sajja Joel, for making time to joining us this afternoon on medical info that makes sense. Now, these sessions are meant to benefit young people, especially people that are seeking careers in the medical field, and that's why we bring you professionals like Mr. Sajja Joel here. And this show is proudly sponsored by Midland High School of Kawempe. Reach out to the 21st century head teacher. He has a very, very strong career guidance session there, and we always go there to benefit his science class. Reach out to him, Mr. Katelega Mark. He will do you good if you're seeking for secondary school education. Thank you so much, Sajja. I'm going to be waiting on to our viewers to send in more questions so that they can have a deeper understanding. For the next time when we meet, I will be engaging you with such questions.
Welcome.
Thank you.
Thank you.